Hello, everyone. It's Monday, November the 16th. And before I get into telling you all about the additional deaths that we have and where we stand as far as our daily positivity or our cumulative positivity, I want to make one more effort. One more effort. One more effort to try to impress upon you as West Virginians that we've all got to pull the rope together and we've all got to stay together in this. It's tough stuff, and I know you're tired, and I want you to surely know that I surely am too. I know that it's at times confusing or frustrating. You know, I know as you're tired in what you're doing, you know that you have surely weight upon your shoulders. Some of you, unbelievable weight, to tell you the truth, because you've lost your jobs or whatever it may be like that. But I want you to know too that I've got the weight of our state on my shoulders, and I carry that with a lot of honor. But at the same time, I want to just get right into what's happened in the last couple of days. Friday, I announced that we were going to tighten up our executive order in regard to wearing masks. Now, first of all, you should know that we had an executive order in place some weeks ago, weeks and weeks ago, if not months, that said you must wear a mask. You must wear a mask if you go into a public building, and in doing so, that was the order that was in place months ago. It did not have that if you could social distance, that was basically the stipulation that we removed. Now, since that time, there has surely been, not by any stretch of the imagination, but some outliers that really are upset over the fact that they believe in their mind, and they're stimulated by this, and I'll get to that in just a second, but they believe that we are stripping away constitutional rights. First of all, I cannot in any way mandate a criminal crime. That's for the legislature to do, and I've said that over and over. Now, from the standpoint of what I have been advised is just this, because I'm asked this question constantly. Well, Governor, what if you issue a mandatory mask wearing mandate and then someone refuses to do so? What happens? And my response to that was just simply what counsel has told me, and I feel confident that they are absolutely right. And that is just this. What will happen is the store owner will ask them to put on a mask or to leave. If they refuse to do so, then the store owner has the option of, just turning away, or a store owner does have the option of calling the police. If they call the police is going to come and ask the people or the person to either leave or put on a mask. If he refuses or she refuses to do so, the police officer then has his discretion as to what to do, but it is within the police officer's discretion at that point in time to say that the person is either trespassing or absolutely possibly, obstructing justice. Now, that is the entire process that you go through. For one thing, as silly as it may be, to just absolutely believe, and it is silly, it is just silly, believe that that we are stripping away your constitutional freedoms. It's ridiculous. I mean, it's not even worth talking about. Or the next thing they're going to do, they're going to come and get our guns, which is absolutely preposterous beyond belief. Let me go back and just tell you just this. There's an individual that ran for Senate and lost. And then the same individual ran for governor, got such a sprinkle of votes in the primary, it was humiliating. It has to be. You know, the people spoke absolutely as clearly as they possibly could. He is constantly rebel-rousing people to go out and do things and do their dirty work basically for him so he can absolutely stay relevant. Now, I'm not going to give him the pleasure to mention his name, but since that time, he has twice now posted my cell phone number, my personal cell phone number, you know, which is it's childish. That's all there is to it. But he's posted my cell phone number on Facebook so everybody in the world can call me, but with it he is urging. Now, what I'm going to have to do is, and for those that are calling now, I don't know who they're calling into because I'm sure not getting the calls, but nevertheless, I'm going to have to move on with basically canceling or that cell phone. Well, there's a lot of good people out there, a lot of good people in West Virginia that need me from time to time and everything, and I have been open to talk to most every single person in West Virginia all along. And now that has got to be taken away because of a child, you know. And so with all that, now, you know, just imagine this. He got such a sprinkle of votes. He couldn't win the Senate race. He got such a sprinkle of votes in the primary that it was unbelievable. I won the primary by 45% of the vote. 45% of the vote. Not against, you know, that opponent, but against another opponent. You know, now think about it. Stay with me just 1 second. Then in the same effort, there's another individual that ran in the general election as a write-in candidate and everything, and he is out doing a lot of the same. Both of those individuals, and you should know that both of those individuals absolutely went on their own crusade trying to get everybody in the world to vote against the Road to Prosperity program. Absolutely, 73% of the people of the state of West Virginia passed a road bond referendum that enabled us to go across this state and do more great work than you can imagine, and never raising your taxes 1 cent. It created jobs upon jobs upon jobs upon jobs, and never absolutely raised your taxes a penny. You've got to make a decision, West Virginia. That's all there is to it. You're kind enough that I got more votes in the general election in winning all 55 counties than anybody has ever gotten in the history of West Virginia. More votes than any governor in the history of this state. And it humbles me because all I want to do is good stuff, and good stuff for all West Virginians. Now, how do I feel about the mask? Well, I don't like them. I don't want to wear them. But at the same time, when it really boils right down to these people that are being pushed by these other people that want to be relevant, you know, just think just for a second. Please just step back and think. For those people that are out there that are being pushed in regard to the mask mandate to object to that, am I not really you? Am I really not just you? You know, I am Donald Trump's best friend. I absolutely stand with guns and for life, for no new taxes, for balanced budgets, for our vets, for Jim's dream to combat this drug situation, for more jobs, and for God. Doesn't that sound familiar in your life? Really and truly, right now, what we have got to do, West Virginians, is just this. We have got to quit these crusades of can you just fathom? Can you fathom? You know, because we ask people to wear a mask as they go in a building with an epidemic or a pandemic that is running across our state like crazy. Can you imagine that these very people are prompted to call me a communist or a dictator or whatever? Are you silly? I mean, absolutely. Can you imagine? It's not the thing to do. It's not the thing for us to do as great West Virginians. Now, let me just keep going here just another few minutes, and then I want to just tell you just a few other things. In regard to the map, in regard to the colors on the map, in regard to playing sports or not playing sports, the map knocking teams out of the sports, and others, whether they be, a mayor that goes completely off the rails, somebody that I help more than you could imagine, but the bottom line to the whole thing is, do you not know and do you not believe how bad that hurts my soul? I want so badly to do right by our kids, our teachers, our service personnel. I take every single decision to heart. We work our tails off on it nonstop, but at the same time, we have got to protect us. We have got to protect our people. So from the standpoint of, just like the other day, a little volleyball girl standing out here, I don't know, I think she was from Putnam County, and by what had happened with their color coding changing and everything, she wasn't going to be able to play in the state tournament. Big tears running down her face. How bad do you think that weighs on me? Well, it does, because I love those kids. I love all of our kids, and I want them to be able to play ball and go to school. But more than anything, I want us to get more control over this terrible virus that's just eating us alive. I want us to absolutely wear our mask. I will not, with all in me, I will not allow people to just decide they're not going to wear a mask. I mean, what right do they have to infect others or possibly infect others? What right do they have to just do that because that's what they want to do? 96% of the people in West Virginia believe we ought to be wearing masks. Without any question, I strongly urge us all to wear a mask. That's all we got to go on right now. I don't know how that is so difficult to do. What if I'm totally wrong? What if this is just smoke and mirrors? I got calls that I took and everything, and people were saying, this isn't real. COVID's not real. It's not real. It's just made up by the media. It's not real. This isn't really happening. It's not real. Well, imagine that. Just imagine that. But what if it wouldn't be real? What is the downside by wearing a mask? What if a month from today we find out it's not real? And you wore a mask and everything and inconvenienced yourself for 30 minutes or whatever it may be going in the store. And people are going to say, well, I can't wear a mask because I can't breathe or whatever like that. And if you've got a breathing problem, we're not talking about you. What is the downside? And every health expert in the land will tell you what the upside is. And you see, I got to listen to those people. I have to listen to those people. Those are the experts. Now, it's a hard thing to balance, is it not? It's a really, really difficult balance all the time. Go to school, don't go to school, play ball, don't play ball, whatever it may be. I mean, a really, really difficult thing. I promise you, all within me, I am trying every way that I know I can possibly try, and you have a governor that is sitting in front of you that teetotally doesn't want a thing. Not a thing for me. Now, for everybody out there, I want you to hear just this. Everybody here is working really hard, and everybody here cares an awful lot. An awful lot about you and about everyone in this state. Our experts are good. They're not a bunch of just fly-by-night people. They are good. They are really intelligent, and I listen to them. Whether they be medical or educational or the National Guard or whomever it may be, I listen to them. This is not smoke and mirrors. It is the real thing, and it is eating us alive right as we speak. Now, I've had several calls that said, well, we want to be like South Dakota. We want to be South Dakota. Well, let me give you a little update on South Dakota. First of all, South Dakota has half the population that West Virginia has. If you've never been to South Dakota, you should go, because there's a house, and then there's 100 miles of cornfield, and then there's another house. Now, in South Dakota, they have 644 total deaths, and they're half the size of West Virginia. We have 585. In South Dakota, they have 19,360 active cases today, and they are the second highest daily cases per capita in the nation. The second highest in the nation. They are among the worst in the country for per capita deaths and per capita hospitalizations. South Dakota has the highest hospitalization rate in the country, with about 42 out of every 100,000 South Dakotans hospitalized with COVID, according to Johns Hopkins. Now, if that's not bad enough for you, catch this one. In North Dakota, there were 2,373 new cases that have come out in the last 2 weeks, which was the highest rate in the country. The governor has just mandated masks last Friday. They announced last week that the healthcare workers, now get this, that the healthcare workers who are positive for COVID, so meaning that the nurses and the doctors and the first responders, the healthcare workers that are positive for COVID, but are not showing any symptoms, can keep working in the COVID units in the hospital. They've announced half capacity in their bars and their restaurants. And on a tour in Bismarck, North Dakota, last month, Dr. Birx, from the White House with President Trump, described the state's mask use and COVID protocols as the worst she had seen anywhere in the country. Now, I want to tell you something else. A bunch of people said, well, we saw your picture at the Marshall game and you didn't have your mask on. Well, I want to tell you just exactly what happened there. I had my mask on 100% of the time that I was at the game. That picture was taken outside in a tent that only had one side of the tent, and the people that had the national championship trophy asked me to take my mask off so they could take that picture, and I put my mask right back on. So you don't need to send that to me anymore. You don't need to send it to me anymore. Do you think just this for a second? I was in a dormitory at Marshall University, and all of a sudden it came across everywhere that the plane had gone down. And all those people, great friends of mine, great friends, were gone. Now, that day was an exceptionally, important day this past Saturday to Marshall University. It was the 50-year anniversary of that terrible, terrible sports event. An event that is like none other in this country to this day. Now just think about it, how important that was. They brought the national championship trophy to Marshall University that day. Almost never, ever, ever do they take that trophy out of any place other than the people that are ranked in the top 5 in the whole country. Absolutely. Tomorrow I would do the same thing over and over and over if they asked me for Marshall University, for those great friends of mine that were lost that day to take your mask off, well, we can take your picture with the national championship trophy. By God, I'd do it in a second. We were outside. Now, I want to tell you in closing just this. We do need to all pull the rope together. We will not get through this by being divided. We need to stop listening to this noise out of people that just want to take your money, to buy their campaign rhetoric, or want to absolutely just be relevant. Silly. It is absolutely silly. You know, I've said it over and over, but you got a good governor that's sitting in front of you that doesn't want anything. I don't like the mask any more than you do. You know, I want us to go to school, and I want us to be able to play ball, but first and foremost, we got to absolutely want to try to get through this and save lives. I don't want any new taxes. I want us to be diversified, but I want us to absolutely recognize how important our coal miners are and try to help them in every way we can to have more and more coal jobs and gas jobs as well. I want tourism to continue to explode, and I want to continue to build road after road after road all across our state, and I want us to have more and more and more surpluses and more jobs and great trout stockings, and I want to help our vets and I help our seniors, and more than anything, I want to stop this virus. Now, I hope you're with me. You have been. I've never done anything but tell you the truth. I need you to wear your mask. I need you to just wear your mask. I know it's a pain in the butt. I know that. But I need you to wear your mask. I need you to quit believing in any way that somebody's going to come and take your guns, or it's unconstitutional, or whatever it may be. Who cares about all that right at this moment? Right at this moment, all we need to do is try to some way break the chain of this killer that's eating us alive. That's all we need to concentrate on. I need your help. I really need your help. Now, we've lost 21 more people since last Friday. And out of great respect for them in every way, I'll read right now. The 565th death is a 71-year-old male from Berkeley County. The 566th death is an 87-year-old male from Summers County. The 567th death is a 61-year-old male from Greenbrier County. The 568th death is a 77-year-old male from Wayne County. The 569th death, an 80-year-old female from Marshall County. The 570th death, an 83-year-old female from Barber County. The 571st death, an 86-year-old female from Kanawha County. The 572nd death, a 57-year-old male from Kanawha County. The 573rd death, a 91-year-old male from Cabell County. The 574th death is a 73-year-old male from Wood County. The 575th death, an 87-year-old female from Marshall County. The 576th death, an 83-year-old female from Putnam County. The 577th death, a 95-year-old female from Ohio County. The 578th death, a 74-year-old female from Ohio County. The 579th death, an 84-year-old female from Putnam County. The 580th death, a 94-year-old female from Putnam County. The 581st death, an 88-year-old female from Putnam County. I'm sorry. The 581st death, an 88-year-old female from Jackson County. The 582nd death, a 78-year-old male from Kanawha County. The 583rd death, an 83-year-old male from Kanawha County. The 584th death, an 80-year-old female from Kanawha County. The 585th death, an 80-year-old female from Jefferson County. Please help me. that we can quit reading all these names. It won't be perfect, but it can be better. And please, please, don't forget these people in your thoughts, your prayers. Please remember all their loved ones and don't let them become a number. They don't deserve that by any stretch of the imagination. We have 801 new positives in the last 24 hours. I think over the weekend we had one day where we had 1,100 and some in 24 hours new positives, which is unbelievable. In the last 3 days, we have received 2,708 new cases. Our daily positivity rate is at 5.31. It was over 6 on one day. Our cumulative is at 3.27. Our active cases in the state of West Virginia are 10,377. If you heard me just a minute ago, for those that want to go to South Dakota, and if you're just hell-bent on going to South Dakota, I'd go to South Dakota. But they have 19,360 active cases in a population half as big as West Virginia, and you have 10,000. And in West Virginia, I'm telling you, it's not good. Recovered cases in West Virginia, 23,498. We now have 383 people hospitalized in West Virginia and 108 in the ICU units, all record highs. This weekend, we tested over 23,000 West Virginians. That's real good. Our reproduction number is at 1.12, and that's probably pretty good across the nation. We now have 4 counties in red and 16 counties in orange. The 4 in red are Marshall, Mineral, Barber, and Jackson counties. Good gracious. We have 16 counties in orange, and those are Brooke, Ohio, Morgan, Berkeley, Jefferson, Hardy, Randolph, Wood, Nicholas, Mason, Putnam, Lincoln, Wayne, Boone, Mingo, and Wyoming counties. I'm going to probably mispronounce this, but it's Moderna, I think is the right pronunciation. They came out with a vaccine report that had that appears to be 94.5% effective. They're following suit with Pfizer, and Pfizer's effective rate was supposedly in excess of 90%. To give you an idea of what that means is like the smallpox vaccination is at 94%. The measles is at 92%. And so these effective numbers are terrific. And this puts both companies on track to seek permission within weeks for emergency use in the United States. The Trump administration, under the Operation Warp Speed Initiative, has committed $2.5 billion to Moderna to support its vaccine research and testing and the opportunity to buy at least 100 million doses of the vaccine. Now look, again, and I'm going to go back to saying something about President Trump. There's, from my standpoint, I want all the legal votes to be counted, and however that falls, it falls. If in fact it falls to Vice President Biden and Kamala Harris, I'll try to work with them and support them and recognize them as our president and vice president. But I still believe that we have votes to count, and we have issues to make sure that the votes are legal. And I think we should allow our president, who has done so much for so many, just think he's the one that stepped up and threw $2.5 billion to Moderna here and everything and helped get this vaccine to us. So many situations just like that, and standing around kicking him in the teeth isn't going to ever get it with me. And so, I hope and pray we got too many people doing that, and that's not fair. It's not right. I don't see any point in going back through our face coverings, mandate that we just stiffened up a little bit, on Friday, and had lots of people just go. Well, not a lot of people, but some people that surely objected to that. I hope and pray that they'll realize that nobody loves their guns more than me. Nobody loves absolutely life in this country from a standpoint more than me, without any question whatsoever. To think that that the government's coming and they're doing this and they're going to take away everything you got and all that kind of stuff. Please quit thinking that. All I'm asking you to do is wear your mask, and I know it's an inconvenience. I know that. Wear your mask, please, please. Let's quit trying to allow people to be relevant and that really, just want to grandstand and make a big play. But please, please wear your mask and everything. You may only have to do it for a month, and it will absolutely save lives. From the standpoint of signage, all of our businesses, we have got to ask them to make sure and have signs displayed about wearing masks. And again, I want to reiterate, for crying out loud, I don't have any powers to get people arrested. I mean, for God's sakes, all I want is absolutely us to take this so seriously, it's unbelievable, and everything, to where we will wear our mask. Moving to winter sports, again, something I sure didn't want to do. I mean, for crying out loud, I've got a little basketball team, and in all honesty, that wasn't very good news to them, and so, but from our standpoint of our basketball, swimming, wrestling, and cheerleading, they'll be postponed until January the 11th, and we have consulted with the SSAC, and they'll issue a new schedule very soon. As far as our travel sports, we need to stop that. We need to stop it. That's all there is to it. Our youth sports have got to be stopped. Those winter sports are the same thing: basketball, swimming, wrestling, and cheerleading. They've got to be stopped for right now. I know we hate that. I know we hate it like crazy. And our kids, we're saying, well, Dad, what are our kids going to do and all this kind of stuff? Well, for crying out loud, we can find lots and lots and lots of stuff for our kids to do. First and foremost, we hope like crazy that they can continue to go to school, but there's absolutely, this is something that we got to stop. We got to stop, teams traveling and coming into West Virginia, teams going out of West Virginia. It is absolutely, we have got to get this under control as best we possibly can. I hate it. I understand it. I've coached at all levels. I was a little league coach. I was an absolute bitty buddy coach at the YMCA. I have coached in every situation that you can imagine. I get it. I totally, totally get it and everything. But if we don't stop doing stuff right now, we're going to just get worse and worse and worse. As a reminder too, the fall sports, if you're a county that has not fallen into the red or the orange, you can continue, and we'll wrap these seasons up and get that behind us as quickly as we possibly can. The United States today has surpassed 11 million COVID cases. In the last few days, we are averaging in excess of 150,000 new cases a day. We added an additional 1 million cases in the U.S., which was the fastest of all times, hands down. There are roughly 70,000 people in the United States in hospitals that are being treated for severe cases of COVID. In at least 45 states, they have reported more new infections this past week than the weeks prior. And in our nation now, we have lost 246,000 plus people. We are averaging in excess, I think, of 1,000 people that are dying a day. Now, I always try to put this into terms where you can really just get a grip on this, but what if I were to announce to you today we had 4 major airliners going across this country, one from Denver to Seattle, one from Chicago to Charleston, West Virginia, one from New York to San Francisco, and one from Atlanta to Bismarck, North Dakota. And they all went down. And they're all gone. How would you feel? What would you do? How stay tuned would you be to the news and everything? How many prayers would you offer up for these people? You see, that's what's happening every single day in America. Every single day, we are losing 1,000 people. Every day. And if we sit on the sidelines and believe, well, I didn't believe we landed on the moon, and I'm not going to believe this is real either. Or we believed, well, this is just the flu. Really and truly, if we believe that, you may choose to do whatever you choose to do. But really and truly, I cannot legislate for the exceptions. I have to absolutely govern for the masses. And I have got to then extend my arms and beg and tell you how much I love you and how much I care and how much I need you with us, because we all need to be together. The testing, before the holidays, I want to encourage, again, West Virginians to get tested before Thanksgiving if you can. The free testing is out there all over the place. The drive-through pharmacy is everywhere. The Saturday education map, we had 5 red counties: Marshall, Mineral, Barber, Randolph, and Jackson County. We had 12 orange counties: Ohio, Jefferson, Hardy, Tyler, Wood, Putnam, Fayette, Wayne, Lincoln, Mingo, Logan, and Wyoming counties. Our school outbreaks, we have 21 school outbreaks now, 118 confirmed in the public school cases in public schools. We have 82 long-term facility outbreaks. We have 20 outbreaks in our churches in 13 counties, and those counties, I always read those counties, are Cabell, Fayette, Hardy, Jefferson, Kanawha, Mingo, Monroe, Preston, Raleigh, Taylor, Tyler, Wood, and Wyoming counties. One thing I want to clear up and everything is those that are, in a church setting and whatever like that, you're in a building, absolutely, I want you to wear a mask. I want you to wear a mask all the time. You're in the building and everything. Absolutely, I understand wholeheartedly, that the elderly may have someone with a breathing problem or whatever that can't. I get it. You don't need to if you can't, but I encourage you highly to wear your mask in the buildings. From a corrections update, the results are back from the testing at the Stevens Correctional Center in McDowell County. The facility has, get this, 254 active inmate cases and 28 staff cases. Cecil Patterson called. Cecil's on the county commission. And we ran to the fire because you've got a good commissioner that called and was really concerned. And he said, this thing is running like wildfire. It's breaking out everywhere. Absolutely, we ran to the facility. 254 now are active as far as our inmates, and 28 active staff cases. It's unbelievable. I had not seen this number right here. It's unbelievable. Stevens remains on lockdown and is following the DCR response plan for COVID. DCR leadership continues to provide guidance and assistance to the facility. Outside of Stevens, there are 7 active inmate cases and 24 active staff cases. And that means all the way across our state. You got to see how when this gets into a population, it goes everywhere. Our flu vaccines are still available. Our grants for our cities are up right at $181 million. We continue to ask the cities to continue to apply, and we encourage all those, as far as our utility bills, to make sure and check that they're caught up and everything, and we were able to help a little bit right there. The only other thing I've got to report is just this, and gosh knows it. This seems like it's difficult in lots of ways because I know what she's going through every day and how hard she works. But happy birthday, Dr. Amjad. It's your birthday. So thank y'all so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon, or almost good afternoon. I don't really have a ton to add to what the governor said. He said a lot. Let me just reinforce a couple of the messages that he sent. So number one is we are seeing COVID-19 more widespread in our country and in West Virginia than at any other time during this pandemic. And instead of seeing it peak and start to get better, we are seeing a almost inexorable increase. It's increasing every day. Every day we average, more cases for that week, and we've set records over the past 2 weeks on several days that have increased over the previous day, and that's both in the U.S. and West Virginia. In the United States, as the governor pointed out, we are seeing more Americans in hospitals today than at any other time during the COVID pandemic. And in West Virginia, we are seeing more people that are COVID positive, both confirmed and probable cases, than we've seen before. Although, as opposed to, say, the Dakotas, as the governor talked about, we in West Virginia still have hospital bed capacity, and we are working very closely with the hospital systems to make sure that we maintain the ability to not have a surge hit our hospitals in the way that we saw, say, in New York City or perhaps some other places in the country. The thing the governor spent the most time on, and I just want to make a really quick comment, it's really about personal rights and our service and our duty to each other. And we all believe very deeply in each American's, each West Virginian's personal right. There's a great book that's a New York Times bestseller book called Humankind, and it's by Rutger Bregman. And basically the book talks about how many people would anticipate during a crisis or during a lot of stress that people would sort of turn on each other. They would look out for their best interests and not look out for others. But in fact, as human beings, as people of the great country of America and the great state of West Virginia, in fact, during those moments, people touch their humanity in a different way, and they start to see the deep connections and the deep service that we commit to each other when we have strong community. And that is what I believe the governor is calling on each one of us to do now, is to demonstrate the fiber, the goodness that comes from each person in the state. And when we look back at 1918, there was anti-mask leagues. This was the same thing we're going through now. When we looked at the seatbelt laws, there was people that opposed the seatbelt laws. But today, we are asking each West Virginian to answer that higher calling. We are in the midst of an unprecedented pandemic. We're in the middle of a crisis in our state, in our country, in our world. But it's a crisis that we have great power to be able to control. And as the governor said, we've seen the second vaccine company, Moderna, that has the same sort of vaccine, a genetic vaccine like Pfizer does, The good news from Moderna's vaccine is it will not require the ultra cold storage. It would be easier to store and distribute, presuming it turns out to also be a successful vaccine, as we hope Pfizer is too, and both of which will apply for their emergency use authorization. But until we get the vaccine to be put out there and be widely disseminated and have enough doses to help each citizen be protected against the COVID-19, it is really our power to wear masks. As we've talked about, if 90% of people, even 80% of people wear masks around each other and physically distance, we will have the benefit of when the vaccine becomes dispersed among the whole population, and we will affect the spread rate of COVID-19 from person to person, just like a vaccine will give us. And we have that power today. And if we don't want to do it for ourselves, as we think about the rights of each person to celebrate their religion in their own way and to celebrate their faith, all religions are based on a single rule, as I understand it, and that is the golden rule. Do unto others the way that you would have others do unto you, or do unto others the way that you would have others do unto people that you love. And we love each other, and we are a vulnerable state that needs each one of our commitment to answer the bell, to run to the fire, to pull the rope in the same direction, to serve the great state of West Virginia, to serve each other. And I, for one, have great faith in our citizenry. And while many people are fearful of different issues, and certainly, we deeply respect each person's individual right, but this call for action is, to me, supersedes each one of our individual focus, because we're really here to make sure that we keep each other safe and we watch out for each other. And by doing that, we continue to be a place that others want to come and be part of. And that is a goodness that I know exists in the state and exists in each person. So I, for one, am very enthusiastically responding yes to the governor's call for each one of us. And I hope that you will follow the governor as I will. Thank you very much.
All right. Thank you, Dr. Marsh. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I know that previously Dr. Marsh has talked about the fact that the actions we take today take several weeks to manifest themselves and to impact the numbers. And so given that, what are the metrics that we're looking at to determine whether or not the most recent measures are having an impact? Can we tell right away, or will it be a while?
Dr. Marsh, go ahead, sir.
So thank you, Charles. That question is a very good one. In general, we'll see the benefit of this over the next 2 to 4 weeks, and the benefit will start quickly. We know that from our local health departments, our testing lanes are now finding more people that are symptomatic, which suggests that that we do need to be very, very urgent in our commitment to wear masks. We also know that the impact on hospitals and healthcare facilities will also build over the next 2 to 4 weeks as we've seen more positives. So it is really, really important that we get going as soon as possible today. But you're right, we'll see the benefits in 2 to 4 weeks that should be maximal based on other experiences we've had during COVID-19, but also the detrimental effects, the downsides, the hospital capacity issues will also be felt in that same time period. So this is the time to stop that part of the COVID pandemic from happening to West Virginia.
All right, thank you, Charles. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel, and happy birthday, Dr. Amjad. The question I have has to deal with quality of mask. If we're going to be wearing masks, I think that quality and whether they're effective or not individually is a key one. Obviously, we all can't have N95 masks out there. I had a person who works with emergency services tell me that if you can blow out a candle through your mask, it's not doing you much good. I'd like to have the medical panel weigh in on that and give me their opinion.
Well, before they go, I'd just like to say just this, wearing any type of mask versus no mask is better with, wearing basically any type of face covering, I'm sure is better than nothing. But anyway, let the medical community, Dr. Amjad, maybe you can go first because you haven't spoken. Again,
Thanks,
happy
Paul,
birthday.
Sure. Thanks, Paul, for the question. I mean, that's what the governor said is true. Any face covering is better than nothing. There are different standards of masks. We do know that cotton face coverings or masks are the best ones to use. And you do want to make sure you're wearing it correctly. You have to cover your nose and then, of course, your entire face. But I don't know that person who told you about blowing out a candle. I've never read or heard that. And also Clay can comment more. But you do have to wear the mask correctly, as stated. But cotton masks are the best to use. And you're right. No one does need to wear an N95 out in public. Those are for healthcare providers who are taking care of, COVID patients. But I'll also let Clay comment because I know WVU has done several studies on masks as well.
Thank you, Ein. Paul, it turns out that any kind of 3-ply masks are good, and you would like to have 3-ply, which is what most cotton masks are made of, and even the manufactured mask. I don't think that being able to blow out a candle would define the mask not being effective. Ultimately, the masks are designed to reduce aerosols and droplets from moving from your nose and your airway out into an environment that other people could breathe in. And the Centers for Disease Control recently came out with further guidance and basically said that even these 3-ply cotton masks, as Dr. Amjad said, are effective not just in keeping you from infecting other people, but also they have an impact in having a reduced amount of risk of other people infecting you. So it protects the wearer too. And I would agree 100% with Dr. Amjad, and I wouldn't use the blowing out the birthday candle as the determinant whether or not the mask is worthy of wearing. Any mask is better than no mask.
All right, thank you, Paul. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. I don't know if you're aware of this yet, but the West Virginia Education Association, one of the two large teachers union in the state, has sent out a request to the governor today. We got in a press release not long ago, requesting that all in-person learning cease and that the rest of the 2020 portion of the school year be strictly online, distance learning. Any reaction to that? Any consideration for that?
Mark, let me answer this as best I possibly can. Now just think about this, and really, I hate to say it, but it's just a fact. From the standpoint of should it be considered, without question, it should be considered. Has there already been a lot of discussions as far as not going back to school and following suit maybe with what the universities are doing? There's already been tons of discussions over the last probably 10 days in regard to that. I naturally, well, I'm not going to get into all that right now. I'll pass to our medical people. Let them, but it's, without any question, there are repercussions to the downside. You've got daycare to think about. You've got our kids to think about. You've got how well the virtual learning is really working, period. There's a lot of educators. There's a lot of, superintendents and everything that believe that we're really, really struggling right there to be able to halfway educate our kids and everything. And it just there's so many ramifications there. It's a lot to consider. Never mind. Anyway, if we could pass on to the to our medical team.
Maybe I'll start and then you can comment if that's okay. Well, thank you, Mark, for that question. We know that there are very, very significant ramifications from the loss of the structure and the opportunity for many of our students to have the education delivered in an in-person environment. Certainly, some of our students have online teaching, either chosen by their families or designated by the color code of the map or decided by local boards of education. But I would point out that for schools and for educators and for the data that I read, there can be a significant impact on a generation of young people who don't have access to that kind of learning because of lack of internet connectivity, a lack of home structure, a lack of people who make them feel safe and loved. And as we start to look at the experience that is gathering around the world, and also here in the US by Emily Oster, who's at Brown University, her data and the data around the world would say that younger children have a much lower risk of spreading the virus to others. Big study from India said that they can spread the virus to young children, but have a much different rate of spreading it to teachers or spreading it in school rooms. It appears as people become older, particularly adult-sized people, then the risk of spreading it may become greater. So I think the governor is correct that there are substantial problems associated with the lack of school systems in many European countries. They have prioritized school over any other business in their country because of the real importance of maintaining that structure and that capability for the students. So it's a very difficult issue, and it's one I know the governor struggles with, Clayton Birch, Superintendent Birch struggles with, and we all want to make sure it's a safe and effective environment, not only for our students, but also for our teachers and our staff. So all those things need to go into that consideration.
Thank you, Mark. And just to add to the governor and Clay's comments, nothing can be off the table, but I have talked with several school nurses who also say that young children are safer in the classrooms if protocols are followed, meaning masks are followed by the staff and so on. And we do know by data around the United States and the country that young children, kindergarten age, elementary schools, do need to be in school for those issues that Clay mentioned. They cannot learn on the internet. They might not have the family structure. Older children, high school age, they can learn on the internet. They are the ones who are most socially involved, who could possibly be the spreaders, but young children are the ones who are suffering. The governor does want to keep his eyes on them, as he says, they don't have the food. They might not have the social life that we would like to have. So those are concerns that we have discussed several times. So these are things that I myself worry about. I have a 6-year-old nephew who struggles learning online himself, and he's very computer savvy. So kids in that generation, that age group, we need to heavily consider. They might not be getting the education they need, but those are things we have to all consider. And it's not just at West Virginia, it's across the country. They are considering all those options for those school-age kids. So anything needs to be considered, but safety is always first, but education, social, those things for kids are very important. Thanks.
All right, thank you, Mark. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. I'm sure this has been gone over before, so I kind of almost hate to ask it, but I presume that probably as we're getting closer and closer to either Moderna or Pfizer seeking emergency approval for their viruses, for their vaccines rather. I'm assuming we're having some conversations in regards with National Guard, federal officials in regards to distribution, especially since I think both of the vaccines had to be distributed and transported at very, very cold temperatures. But I know that the Operation Warp Speed czar was basically saying that starting in December, Americans could expect to see about 25 to 30 million people vaccinated each month afterward once that approval happens. So what conversations or any updates rather have you all received in regards to distribution of any vaccine, whether it's Moderna, Pfizer, or it could very well be both? Thank you.
Well, Stephen, I'm going to pass to General Hoyer in just one second here, but I'd like to just say this, that what an incredible job they continue to do. We had a discussion just the other day, about how on top of this they are, how big a challenge it will be and everything, but they'll get it done. FEMA, I know the FEMA people are going to be here this week to have further discussions with all of us in regard to the vaccines. And but General, you could maybe fill them in on all the great work you're already doing, and but we're on top of this.
Yes, sir, Governor. Stephen, there's a group led by a young lady in DHHR who is working the vaccine distribution and administration planning. There are 20 organizations, and I say organizations, not agencies, because there are many entities outside of state government that have to participate in this process. The Guard is fully engaged with them and is working with them on the logistics support, security. We've already had contact with different organizations about additional freezer space, as well as things like dry ice that might be needed, and the components that would be needed in the way of vehicle support and other things. So that is an ongoing effort. They work on it daily. There is an engagement with CDC this week, led by DHHR in that group. And I'm pretty confident right now, as is, I believe, the Secretary and Dr. Amjad, that we have a good team working forward on the planning process and the execution piece.
All right, thank you, Stephen. Governor, I'll turn it back to you.
Well, I've talked an awful lot today. I hope to goodness that everyone's really paid close attention and really listened. Everyone should surely know that from an education standpoint, I can't imagine that there's ever been a governor that stood, for education more than I. Whether it be A through F, getting rid of that, or the unnecessary testing, or the pay raises, or just standing steadfast and trying to help in every way I possibly can. I'd be lying to you if I didn't tell you that it would cut pretty daggum deep when your union heads and union bosses and everything trotted off in a different direction and ended up, going with a side that lost 55 out of 55 counties across the state. And it was, and from what I would say is just this: if I were one of those members, I'd be looking for new representation. That's all there is to it. If I were a member paying dues, and that's what I was delivered by my union bosses, I would absolutely be looking elsewhere. But with all that being said, I can tell you just this, that I'm going to stand rock solid with education. I'm going to always try to help in any way I possibly can. Without any question, I am very proud that we put a stake in the sand making education our centerpiece. And without any question whatsoever, from the standpoint of of should we keep our schools open or should we not. You know, naturally we're going to take into consideration all the different aspects of everything that's out there, you know, that's from the standpoint of we've got to educate our kids. From the standpoint of the numbers in our schools are really not bad at all. You know, the numbers really got kind of out of control with people traveling, playing ball, and doing all the different stuff that we were doing there. But the numbers in the schools still remain pretty dadgum good, and the schools themselves still remain somewhat of a safe haven. Now, we're watching it. We know how important it is to have our kids in school. And we absolutely know how important it is to the economies that we're able to continue to work. And families may very well have to stay home if we don't go to school. We get every bit of that, you know, and so I would be leery of decisions that are made in representation of lots and lots and lots of people, and they've been made in a very, very, very bad way. So with all that being said, because never have you had a governor that stood behind education like I have, and I've done that proudly too. But I can tell you it hurt, and so with all that being said, I'd like to just end as much on a good note as I possibly can and say, you know, I thank all of you for the honor that you gave me in the last election and that you've given me over the last 4 years. You gave me more votes than anybody ever running for this office in history. That means that you've really entrusted me, and I'm not going to let you down. I'm going to plead with those that decide that, you know, by God, I don't have to wear a mask, and you're trying to take my constitutional rights. I'm not trying to do that. I'm not trying to do that in any way. All I am trying to do is save lives and do the only thing that I know I can do. You see, today in my toolbox, that's all I've got. I don't have a vaccine today. I do not have anything in the toolbox other than the possibility of shutting businesses down. Do you think I want to do that? Have you lost your mind? The last thing on earth that I want to do is shut our businesses down and put more people unemployed. Absolutely, it's the last thing we need to do to stop going to school. The last thing we need to do is shut our businesses down. But we've got to contend with this, don't we? And it's a heavy load. And I wish to goodness that we would all just continue to try to pull the rope together. But thank you all a bunch. God bless each and every one of you.